So we will be seeing the steps of total abdominal hysterectomy by using vessel sealing clamp. So this was the patient 52-year-old para 2 leaving to tubectomized with large and multiple uterine fibroids. Her per abdomen, her uterus size was 18 to 20 weeks of gravid uterus. So we opened the abdomen with Phalansteal's incision, and now we are dissecting the subcutaneous tissue and till the rectus and rectus sheath and rectus muscle. So in these steps we have to be careful about the if any adhesions are present or not. Then we are taking out the uterus. At this step the uterine size was around 18 to 20 weeks of gravid uterus. So we are pushing the bladder down, and now we are going to the right side of the round ligament. So identification of the uterine structures are important because as per the size of uterus the anatomy is totally distorted. So we have identified the right sided of the round ligament, and now I am applying the vessel sealing clamp. I am going more on the specimen side because it will cause minimum damage of the thermal spread. So here I am coagulating the round ligament in 2 places, and after that I am cutting in between. So now this is the left side round ligament of the uterus. So identification is important. Here I am putting one Babcock's forceps for proper grip over the round ligament. Now we are cutting it with the vessel sealing clamp. First we are coagulating at 3 places, and then we are cutting in between. So you can see in the video that I have coagulated it at the 3 places, and now I will cut in between with the help of our regular scissors. This Babcock was just for holding of the round ligament. And now another next step will be separation of the bladder. So I am going from one round ligament to another round ligament and dissecting the bladder as a routine procedure. So the advantage of dissecting the bladder plane in vesico-uterine plane is that ureter will fall behind and we can push the bladder down properly. So it will avoid the bladder injury, and also it will help the ureter to fall back. So chances of ureteric injuries are also less. So we are going inside the utero-vesical plane. There are some vessels at the bladder base. I am just coagulating it with the help of cautery. And I am pushing the bladder down with the help of sponge on. More we can get bladder down, more it will be easier for us to get the uterine clamp and now identification of the next step will be identification of cornual structures. So she was 52-year-old. So I'll do her total abdominal hysterectomy with bilateral salpingo-oophorectomy. So that's why I am clamping it over the infundibulopelvic ligament. There is no need to place the clamp. I am just keeping the clamp for the sake of safety and to avoid the thermal spread. So I am coagulating with the help of vessel sealing clamp over the infundibulopelvic ligament. And just for my safety and OCD, I am taking a free tie. It is really not needed for this procedure. You can skip this step. So I am transfixing the infundibulopelvic ligament with the vicryl number 1. This I will repeat the same procedure on the left side, and you can see there is absolutely no bleeding from any not from specimen side also, and from because of the coagulation. It has proper coagulation, and my settings for the vessel sealing clamp are set on the L2 mode. So I am going on the left side, creating window inside the broad ligament. After creation of the window, as I want to remove the ovaries, so I will clamp the infundibulopelvic ligament so that the tubal structure and the ovary both will be removed simultaneously. And now I am applying the clamp. We should apply the clamp and coagulate it minimum for 1 to 2 centimeter area. So it will be easier to cut and there will be absolutely no bleeding. And just for the sake of safety, I am taking infundibulopelvic ligament and transfixing the ligament with the help of Vicryl number 1. So the next step will be identification of the uterines. I am skeletonizing the broad ligament. It will help the ureter to fall back and we will avoid the injury towards the ureteric side. So the uterine clamp should be water under the bridge, means it should be more in the right angle to the uterus. All the steps are same as routine hysterectomy, just we are using the vessel sealing clamp to minimize the bleeding. It will save our operative time also, and it will minimize the post-operative pain for the patient. So now I have taken the uterine. For uterine also I am transfixing the pedicle, just for the sake of safety. It is really not needed. You can skip this step. Till the uterine and sometimes till uterosacrals, this procedure is same as doing laparoscopic hysterectomy. But just because her uterus size was 20 to 22 weeks, I chose abdominal approach.